American Health Care Act. March 13, 2017. Cost estimate. CBO injunction estimate that enacting the American Health Care Act would reduce federal deficits by $337 billion over the coming decade and increase the number of people who are uninsured by 24 million in 2026 relative to current law. Summary. The Concurrent Resolution on the budget for fiscal year 2017 directed the House Committees on Ways and Means and Energy and Commerce to develop legislation to reduce the deficit. The Congressional Budget Office and the staff of the Joint Committee on Taxation, Junction, have produced an estimate of the budgetary effects of the American Health Care Act, which combines the pieces of legislation approved by the two committees pursuant to that resolution. In consultation with the budget committees, CBO used its March 2016 baseline with adjustments for subsequently enacted legislation, which underlies the resolution, as the benchmark to measure the cost of the legislation. Effects on the federal budget. CBO injunction estimate that enacting the legislation would reduce federal deficits by $337 billion over the 2017 to 2026 period. That total consists of $323 billion in on-budget savings and $13 billion in off-budget savings. Outlays would be reduced by $1.2 trillion over the period, and revenues would be reduced by $0.9 trillion. The largest savings would come from reductions in outlays for Medicaid and from the elimination of the Affordable Care Act's, ACA's, subsidies for non-group health insurance. The largest costs would come from repealing many of the changes the ACA made to the Internal Revenue Code, including an increase in the hospital insurance payroll tax rate for high-income taxpayers, a surtax on those taxpayers' net investment income, and annual fees imposed on health insurers, and from the establishment of a new tax credit for health insurance. Pay-as-you-go procedures apply because enacting the legislation would affect direct spending and revenues. CBO injunction estimate that enacting the legislation would not increase net direct spending or on-budget deficits by more than $5 billion in any of the 4 consecutive 10-year periods beginning in 2027. Effects on health insurance coverage. To estimate the budgetary effects, CBO injunction projected how the legislation would change the number of people who obtain federally subsidized health insurance through Medicaid, the non-group market, and the employment-based market, as well as many other factors. CBO injunction estimate that, in 2018, 14 million more people would be uninsured under the legislation than under current law. Most of that increase would stem from repealing the penalties associated with the individual mandate. Some of those people would choose not to have insurance because they chose to be covered by insurance under current law only to avoid paying the penalties, and some people would forego insurance in response to higher premiums. Later, following additional changes to subsidies for insurance purchased in the non-group market and to the Medicaid program, the increase in the number of uninsured people relative to the number under current law would rise to 21 million in 2020 and then to 24 million in 2026. The reductions in insurance coverage between 2018 and 2026 would stem in large part from changes in Medicaid enrollment, because some states would discontinue their expansion of eligibility, some states that would have expanded eligibility in the future would choose not to do so, and per enrollee spending in the program would be capped. In 2026, an estimated 52 million people would be uninsured, compared with 28 million who would lack insurance that year under current law. Stability of the health insurance market. Decisions about offering and purchasing health insurance depend on the stability of the health insurance market, that is, on having insurers participating in most areas of the country and on the likelihood of premiums not rising in an unsustainable spiral. The market for insurance purchased individually, that is, non-group coverage, would be unstable. For example, if the people who wanted to buy coverage at any offered price would have average health care expenditures so high that offering the insurance would be unprofitable. In CBO injunction's assessment, however, the non-group market would probably be stable in most areas under either current law or the legislation. Under current law, Most subsidized enrollees purchasing health insurance coverage in the non-group market are largely insulated from increases in premiums because their out-of-pocket payments for premiums are based on a percentage of their income. The government pays the difference. The subsidies to purchase coverage combined with the penalties paid by uninsured people stemming from the individual mandate are anticipated to cause sufficient demand for insurance by people with low health care expenditures for the market to be stable. Under the legislation, in the agency's view, key factors bringing about market stability include subsidies to purchase insurance, which would maintain sufficient demand for insurance by people with low health care expenditures, and grants to states from the Patient and State Stability Fund, which would reduce the costs to insurers of people with high health care expenditures. Even though the new tax credits would be structured differently from the current subsidies and would generally be less generous for those receiving subsidies under current law, the other changes would, in the agency's view, lower average premiums enough to attract a sufficient number of relatively healthy people to stabilize the market. Effects on premiums. The legislation would tend to increase average premiums in the non-group market prior to 2020 and lower average premiums thereafter, relative to projections under current law. In 2018 and 2019, according to CBO and Junction's estimates, average premiums for single policyholders in the non-group market would be 15% to 20% higher than under current law, mainly because the individual mandate penalties would be eliminated, inducing fewer comparatively healthy people to sign up. Starting in 2020, the increase in average premiums from repealing the individual mandate penalties would be more than offset by the combination of several factors that would decrease those premiums: grants to states from the Patient and State Stability Fund, which CBO and Junction expect to largely be used by states to limit the costs to insurers of enrollees with very high claims, the elimination of the requirement for insurers to offer plans covering certain percentages of the cost of covered benefits, and a younger mix of enrollees. By 2026, average premiums for single policyholders in the non-group market under the legislation would be roughly 10% lower than under current law, CBO and Junction estimate. Although average premiums would increase prior to 2020 and decrease starting in 2020, CBO and Junction estimate that changes in premiums relative to those under current law would differ significantly for people of different ages because of a change in age rating rules. Under the legislation, insurers would be allowed to generally charge 5 times more for older enrollees than younger ones rather than 3 times more as under current law, substantially reducing premiums for young adults and substantially raising premiums for older people. Uncertainty surrounding the estimates. The ways in which federal agencies, states, insurers, employers, individuals, doctors, hospitals, and other affected parties would respond to the changes made by the legislation are all difficult to predict, so the estimates in this report are uncertain. But CBO and Junction have endeavored to develop estimates that are in the middle of the distribution of potential outcomes. Macroeconomic effects. Because of the magnitude of its budgetary effects, this legislation is major legislation, as defined in the rules of the House of Representatives. Hence, it triggers the requirement that the cost estimate, to the greatest extent practicable, include the budgetary impact of its macroeconomic effects. However, because of the very short time available to prepare this cost estimate, quantifying and incorporating those macroeconomic effects have not been practicable. Intergovernmental and private sector mandates. Junction and CBO have reviewed the provisions of the legislation and determined that they would impose no intergovernmental mandates as defined in the Unfunded Mandates Reform Act, UMRA. Junction and CBO have determined that the legislation would impose private sector mandates as defined in UMRA. On the basis of information from Junction, CBO estimates the aggregate cost of the mandates would exceed the annual threshold established in UMRA for private sector mandates, $156 million in 2017, adjusted annually for inflation.